Hello, welcome. My name is Jodi Scholes. I am your instructor for the MBLEx Review Course. Welcome. Today we are doing lower body anatomy. That is next on our list. Through this time together, we cover 8 different categories, all that which relate directly to what you'll be tested on during your massage and bodywork licensing exam. So the MBLEx. Yeah, so today we're doing lower body. Class goes down in 3 rounds. So the first round is going to be some words of wisdom about your test taking. So some test taking strategies. Second part of class will be lower body anatomy. So we do some learning. And then in the third part of class, we're going to dissect some questions. So getting you some practice. And yeah, what we're doing is working. I'm seeing it in the results. And so let's march in. Let's march through. All right. What I want to talk to you about this morning, this afternoon, this evening, whenever you're actually doing this, is about this process of taking the MBLEx. And we know it's challenging. And yet, here we are. If you are listening to my voice, most likely you've already taken the MBLEx at least once. And because you're within the sound of my voice, if you're within the sound of my voice right now, I can tell you I know something about you. And that is that you are meant to do massage therapy. This profession, yes, you chose the profession. But let me assure you, this profession chooses you. This is way bigger than earning a living. You want to go earn a living? Fine, you can go work on the corner shop. You can find a job. There's plenty out there. As much as massage therapy is a profession, it's also a calling. We could pause and listen to each one of your stories right now, and you would be telling me about what motivated you to become a massage therapist. I hear about when you were kids, rubbing someone's shoulders, taking care of a mom or a grandma who was in pain, and the connection. You guys, not everybody has that. Not everybody has that. Not everybody feels that. Not everybody wants to hold space to create safe, nurturing, non-judgmental space through the vehicle of massage. So, yeah, this journey is bumpy and sometimes it takes unexpected turns. But you know what? You're doing it. And you're gonna do it. Yeah, you are. You're listening right now. You're sending a clear message to the universe that you are ready. And we're gonna get it done. So, wanted to rekindle that spark, that flame that's within your belly. I want to rekindle that fire that is inside of you, because this is a tough, this journey can be bumpy, it can be unexpected, it can be not like what you thought. Yeah, and yet it's perfect. And so I just wanted to rekindle that why in you, because we are at our best when we know why we're doing something. Yeah. So let's get to it. Ready to do a little learning? Welcome back. Many of you are studying with me regularly. I'm so happy for that. So welcome back. Today we're doing a review of the anatomy and movements of the lower body. Just to make sure everybody's muted.
Be like that to her.
There we go. Yeah. All right. Today we're talking about the anatomy of the lower body. We're going to be doing anatomy, and we're also going to be doing some kinesiology, some movements of the lower body. Let's get to it. We're going to be talking about the pelvis, the legs, the ankles, and the feet, if we get that far. Okay, so what are our learning objectives today? We want to be able to identify the regions of the lower body. We want to understand the anatomy of the lower limbs. We're going to be able to identify each bone and many of the major muscles of the lower body, including the pelvis. Uh-huh. Yep, we're going there. You know it. Here comes the psoas. It's coming. All right, so describe the bones of the lower and the bony landmarks. We're going to talk about the joints, what type of joints are in the lower body, and we're going to understand a little bit more about the bony landmarks and the locations of muscles within bony landmarks within the pelvis as well. So shout out to Books of Discovery and Trail Guide to the Body, because they gave me permission to use these images, some of the images. But let's talk about the lower leg and the regions of the lower leg. Because when you are taking your MBLEx, we need to, with these anatomy questions, we need to be able to identify the region of the body that we're in. So the region of the body. So we need to understand if we're in the upper body or if we're in the lower body. And so let's take a look at these regions of the body. Let's notice the lighting in here is wonky. Yep. Okay. Popliteal fossa. Popliteal region, right here behind the knee. We identify it because it's an endangerment site, and we don't want to put direct pressure in the middle part of the knee. Over here on the lateral aspects, very nice to do body work. Very nice. This is where our IT band attaches. There's some lovely ligaments to work around the knee. The scientific name of the kneecap is the patella. Just below the patella is something called the tibial tuberosity. Okay. You're never going to need to know that outside. You're never going to need to say that word to your client, tibial tuberosity. But it is where some bony landmarks. It's a bony landmark that is at, if the knee is a clock face, the tibial tuberosity is at 6 o'clock. We've got an attachment site with this pes and serinus. We're not going to spend too much time on that, but just know if you see pes A, right here, oops, pes A, it's up. You're going to see pes planus. Actually, pes planus is another word for flat feet. We've got a couple of peses. Some, in this case, this is a bony landmark, but pes A and serinus. Think of it as A, the start of the alphabet, first letter of the alphabet. It's the highest of these pes words that you're going to need to know. Gastroc has 2 heads. It's that nice heart-shaped muscle that we call your calf. The shin bone is also called the tibia. The tibia is what you feel your shin bone. We'll take a look at the bones of the lower leg in a minute. But the muscle, the tibialis anterior, you can actually, if you're sitting down, you can feel it. Just go a little lateral. So lateral, a little outside, a little lateral of your tibia, a little lateral of your shin bone. It's a big, beefy muscle right there. It's called tibialis anterior. It's immediately adjacent to the tibia. All right. We've got that shaft of the tibia. Here we see that gastroc again. Beneath the gastroc is another lower leg muscle called the soleus. And the soleus and the gastroc make their way down. And I'm not gonna ask, I'm gonna just tell you today that muscles are attached to bones by tendons. So we've got ligaments and tendons. Ligaments attach bones to bones. Tendons attach muscles to bones. These come down, and you see turn into the calcaneal tendon. I will ask you to put in the chat right here. What is the common name of the calcaneal tendon? You know it. You know it. Calcaneal
Ankle.
tendon. Oh, Ensley. I think that was Ensley. Was that Ensley?
Yep.
Okay, what'd you say?
The ankle bone.
The ankle bone. Oh, swing and a miss on that one, brother. It's the ankle bone, yes, but the tendon has a common name.
Oh, okay.
Yeah, but we're at the ankle bone right here. Yeah, so the ankle, hang on. We're right here. So the calcaneal tendon, take a peek. There's the ankle. It looks like you might have missed that line. So there's the lateral malleolus, the medial malleolus. And yes, Indira grabbed it. V, yes, Val. Latrice, you got it. Juliet, yep. Good to see you, Juliet. I think this might be one of your first few live classes. Vanessa, Tiffany, yes. Deborah, yes. It is the Achilles tendon. That's right. You may see either name on the MBLEx. This calcaneal tendon is also called the Achilles tendon. Calcaneal because this heel bone is a bone called the calcaneus. Great. So we go down lateral malleolus, medial malleolus. Those are the bones that actually make up what look like your ankle bone. They're called the medial and the lateral malleolus. And if you were palpating the tibialis anterior tendon, so here's the tibialis anterior, that beefy muscle, comes down, crosses in front of the ankle, and because tendons attach muscles to bones, this is the tendon of the tibialis anterior. And we got the extensor digitorum longus tendons in here. Those are the top of the foot. All right. A few new words in there. Let's take a look at this yummy pelvis. All right. And these are the major muscles of the pelvis that you will need to know. These are the big ones. Got another slide in there. All right. Let's look here, here. Let's come back to this when it's labeled. But just know that we've got a few muscles in here that we're looking at. We'll see them from a different angle with the label. Although this is the anterior version. Let's start here. Psoas major, psoas minor. There is a major and a minor. If you are asked to distinguish between the two, they work hand in hand. It's not like teres minor and teres major. Bonus points. Who can put in the chat, where is the teres major and teres minor? What part of the body? Flash question. Flash.
Shoulders.
Yes, Ensley, thank you. And in the chat, what do we got? I can't see the chat anymore. Okay. Yes, and Dara says the scapula. I like it. Under the arm, that's where that's where this group of muscles live. So teres minor technically isn't under the arm, but it feels like you're going under. The only one that's technically under the arm is a different one. What is this? What is this category? Teres major, teres minor. Teres minor is a part of a group with 4 other muscles. Has an acronym. Yes, 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 yes. I love it. Axillary border, correct. That's exactly where the teres minor is it, Muriel, it feels like it's under the arm, but it's actually not. It's just at that border right here. It's technically on top of the shoulder blade. And so sits the rotator cuffs. Yes. Look at you guys. All right, I'm calling you. Tiffany, yes. Muriel, thank you. Yes. Indira, you got it. Juliet, yes. I love axillary border. That makes me happy.
Great.
Yeah, Lana, good. Juliet, yes, yes. Rotator cuffs, yes. Rico, good. Bridge, yep. Indira, you got it. Sits, yep. Vanessa, good. Valerie, yes. Deborah, good. Excellent. Good, good, good. So teres major and minor, we make a distinction. Psoas major and minor, normally not. We're normally only talking about psoas major. Yeah, good. Thank you. Thank you, Diana. Yes, good. Yolanda, yes. Excellent. All right, so inside this crest, so here's the iliac crest, otherwise known as the hips. When we say we put hands on hips, it's up, right? So hips, our hips anatomically are this, which we will cover. But in this case, the iliac crest, got that going on. Inside the iliac crest is the iliacus. These are muscles you are going to need to know. You don't need to know what movement they make yet, but I do need you to know where they are in the body, what region of the body they're in. So it can feel like, holy shit, sorry. It can feel like a lot. It can feel like, oh my goodness, can I remember all of this? Let's start with just where they are in the body, okay? Never mind origins, insertions, actions. Just know where they are in the body. So iliacus is right here inside that crest. So in working it, we actually wrap our fingers around the crest and we can do a little fine vibration on the iliacus, often very ticklish. Adductor brevis. Okay, so here's the hip. We're on the inside of the hip, the adductor regions, right? Adductor brevis, adductor longus, and gracilis. Yes. Thinking about something with that gracilis the other day. Just know the gracilis is in the middle. It's one of those adductor muscles. These two are easy to remember, right? They say adductor, right? But the gracilis is also in there. Good. A few more anatomical bony landmarks for you in the pelvis. And so where the sacrum, the flat bony muscle, the flat bone at the tailbone, the very bottom of the spine, we got a sacrum, right? You can see it here from, this is a different kind of side view. But where that sacrum touches the ilium, it is called the sacroiliac joint. And so we'll see another picture in a moment, but it's a triangle. If you're imagining in your mind's eye, the triangle. So the two sides of the triangle, those are the sacroiliac joints. It actually exists. Yeah. There used to be funny movies and they'd be, oh, my sacroiliac. Yeah. Well, that joint actually exists, and it's the where the two bones touch between the sacrum and the ilium. Okay. Technically, the ASIS is right here. It is the front part. If you are looking at a bony landmark on your hip, on your ilium, we are looking at the ASIS, which stands for the anterior superior iliac spine. Anterior superior. And you may be asked about this again. You don't need to know what muscles attach here yet. All I want you to do is just get into the region of the body. Where are we? Because once we understand where are we, then we can get to the best answer. Right. Purposely for your test. Now, when you go on to take continuing ed, and you're doing sports massage or doing orthopedic massage, then you may need to learn a little bit more deeply. But for right now, just know ASIS right here in the front of the hip. And then there's also a bony landmark here, and that is called the greater trochanter. Right there. Now we're down into the head of the femur. and the greater trochanter is right there on the outside part of the femur. Here's a nice big picture of it too. The greater trochanter. Thank you. Yes, I'm glad you feel that way, Miro. All right, next. So a different image, a better look at the sacroiliac joint. These again are called iliums. You have two, even though it's one pelvis, it's two iliums. Nice, beautiful picture of the sacrum from the anterior. And right there where that sacrum touches the ilium, the sacroiliac joint. We're going to move away a little bit from the nerves that are in this area, but I did want to mention the names of them. So one of the nerves that flows through here is called the obturator nerve, and that has to do with this hole. So the hole is called a foramen. So like George Foreman, you know, if you see George Foreman, imagine George Foreman's face right there in that hole. It's actually foramen, but the obturator foramen is that hole at the bottom of the pelvis. You rarely see you're rarely asked about these Bony landmarks, but I just want you to be familiar again with the region of the body you're in. If you see obturator foramen, obturator nerve, you're in the pelvis. Okay. There are two sides to this pubic ramus. So ramus, like it's making a ring. In the middle here is that pubic symphysis. So ramus, when you see pubic, you're gonna know that you're in the pelvis, right? Yeah. So the pubic ramus here, and the synthesis, when you synthesize something, you bring it together. The pubic symphysis is in the front. Okay. Well, hello. So through the miracle of modern editing, I can come to you right now in the middle of class and let you know there's about another 20 minutes of the class, but you are going to transition to dissecting questions because this is the short version. If you are enjoying this content, I encourage you to consider becoming a patron at patreon.com/Jodi Scholes. It'll be in the notes right here in the comments. So you can find us, find the community, and get the full recordings. So hope you're having an awesome study session, and I look forward to seeing you soon. Back into your vocabulary. All right, that was a lot. Ready to dissect some questions? Okay. Shake it off, shake it off, shake it off. We're going to integrate what we know into dissecting some questions. If you need to hop off, go for it. Know that the recording will be posted this afternoon, but we've got probably about 7 or 8 more minutes to go through these questions. You up for it? Cool. The acronym ASIS stands for A, B, C, or D. Go ahead and take a look. Go ahead and take a look. Careful. Whoa. You guys are ready for the questions, man. Yeah. Rico, yes. Latrice, yes. Diana, yes. Enzo, you got it. Mimi, yep. Lana, yep. Bridge, yep. Brittany, yep. Yolanda, yes. Tiffany, yes. Vanessa, good. Melissa, yes. Excellent. Thank you. Let's eliminate one wrong answer, because when we get stuck, that's all we do. So we know it's not the scoliosis ilium scale. It is letter D. Anterior superior iliac spine. Nice job, you guys. Good. You know where you are in the body. I'm proud of you. Okay. Which leg bone, does not carry any weight of the body? Now, we didn't talk about this today, but you're going to use your clinical reasoning to think about leg bones, not foot bones, leg bones. Which, like, you're going to use your clinical reasoning. Okay, let's take a look. We got answers. Look at you. Indira. Yes, Ensley. Yes, Bridge. Ooh, all these names are flying through me. Okay. Latrice, you got it. Yep. Tiffany, you nailed it. Diana, look again. Muriel, Yolanda, you got it. Rico, yes. Melissa, yes. Vanessa, yes. Lana, yes. All right, let's get rid of one wrong answer. We can get rid of letter D because the ulna is not in the leg. Yeah. All right, so I'm going to give you a hint. It's a little bone. It's the littlest bone in the leg. Not in the foot, not in the ankle. Ooh, I see another answer coming in. Yes, the ulna. Where's the ulna? Where's the ulna? Thank you. Yes. Forearm, arm. Yes, it is. Thank you. All right, best answers. You guys got it. Nailed it. Fibula. Okay, but good to know. Doesn't technically carry any weight. You'll see varying opinions on that, especially as more research is done. But for the purposes of our conversation, that's the best answer. The blank is the largest sesamoid bone in the body. The blank is the largest sesamoid bone in the body. An hour ago, you would have been freaking out at this question. Now I see 12 answers like that. You got it. You guys, right. Let's get rid of one wrong answer. Let's eliminate one. So it's not the medial malleolus, right? That's the distal end of the tibia, which you know now. Best answer? You nailed it. Letter B. Good. We do have other sesamoid bones, but I really am not worried about those. The patella is the one that most often comes up in your questions. The blank is the common origin for the hamstring group. The blank is the common origin for the hamstring group. A, the lesser trochanter. B, the ischial tuberosity. C, the fibula head. D, the pes anserus tendon. We talked about all of these today. Where are you going? Look at you guys. Holy mackerel. You absolutely nailed it. All right, let's get rid of one wrong answer. It's not the head of the fibula, because that's not where the hamstrings are, right? Hamstrings are in the leg, but in the posterior compartment in the upper part. All right, best answer? Boom, ischial tuberosity. Watcha. You nailed it. Good job. Ooh! The obturator foramen is located in the blank. Ooh, if you got to class late, you may not have heard this. Is it A in the shoulder girdle, B in the knee, C in the pelvis, or D in the ankle? All right, let's take a look. Obturator foramen. Looking good, you guys. Let's get rid of one wrong answer. Our whole class today has been on the lower body. It's not in the shoulder girdle. But y'all grab the best answer right away. Letter C, pelvis. Good. Remember, it's the hole. We're going to see George Foreman's face in that little hole in the pelvis. the obturator foramen. All right, there we go. Thank you for your time and attention. You guys did a great job today. In fact, today, very pleased with your participation and with your comprehension. You really got it. Bravo. Bravo. So things are starting to stick. Excellent work. I will go ahead and wrap up this recording by reminding you, my name is Jodi Scholes. I am your instructor for the MBLEx Review class. We are all patrons. We are in the patron community studying for this doggone test. Yeah, and we're getting it done. We're getting it done. We'd welcome you there if you're watching this afterwards. And thank you. Thank you, thank you, thank you. Let me just tell you, thank you so much for becoming a patron, for pledging to have a monthly donation. I really appreciate it. I do this because I love doing it, but of course, we all need a job, right? And this is my job. So thanks again. Catch up with you real soon.